this afternoon I'm going to talk about surgical correction, different approaches for different folks. And the objective to clarify the deformity characteristics, which Dr. Lebel has done, review some of the goals of surgical correction, and discuss considerations prior to surgical correction. So again, this myth that scoliosis is this when your spine is shaped like an S, and the goal of surgery is to straighten it like an I or an L. And that's not completely true, as we've learned from previous talks. The facts remain that there is some lateral deviation or side-to-side bending, and that the building blocks of the spine are actually abnormal. And also there's this twisting deformity of the vertebra, creating this three-dimensional deformity, which was discussed earlier, in addition to the ribs and the chest being misshapen. And this is what it looks like. Again, you can find the shoulders being uneven, prominent shoulder blades, waist asymmetry, trunk shift, and just a curved spine. And the side view, you can see this flattened back, which Dr. Lebel has also mentioned, and these asymmetric shoulder blades. And this axial view, or this top-down view, it's really difficult to appreciate the deformity here, but it actually worsens the deformity on the frontal and the side plane. And you see on these bending images the rib hump and this lateral deviation here. Imaging has definitely been one of the things that we've made great strides in recently, and with this 3D imaging and these low-dose radiation, we're able to really get a good picture of this deformity and see how it actually exists in 3D space. And it really helps us understand this as we continue to develop treatments for it. So in surgical correction goals, I guess one of the primary goals is to have a solid fusion, and that's when we're talking about spinal fusion, the critical point of the parts of the deformity. And those are the ones that are most involved in the actual deformity and not a compensatory deformity. We'd like to safely preserve as many motion segments as possible, and this is something we strive to do, and this goes into when do you do surgery, and who do you do surgery on, and whether it makes a difference if you wait till next year, next summer. Is it going to change how much motion you can preserve? And in addition, to safely restore or preserve this natural or harmonious shape of the spine, which we've talked about in this three-dimensional contour. So considerations for surgical correction. Every patient is different, but some of the things we consider for just about everyone is where is the deformity? That's going to dictate what part of the spine we fuse and how much is necessary to fuse, and how that's going to affect you clinically. What is the deformity? And again, when we looked at the flat back, does that deformity cause flattening of the thoracic spine, which is supposed to have a little bit of a hump to it? And so do we have to consider that when we actually fix your spine? The flexibility of the deformity, and that will help us determine how much of your spine needs to be treated to actually treat the, the structural portion. And how does your spine differ from normal anatomy? And again, this is going back to, depending on where the deformity is, it's probably doing something different to your back, and that needs to be addressed as we plan for surgery. And here are just some patient-specific considerations. Again, your bone age or your level of maturity. So according to how old you are and how much growth you have left, we may treat different curves similar curves completely differently, because we expect one to progress and one to stay the same. Again, then there's your body habitus. When we do correct a deformity, we have to understand, well, does this patient have a significant rib hump, or whether their lumbar curve is hidden by their abdomen. We have to understand the magnitude of the deformity, and that will also help us choose when it's best to do something. Whether the deformity has progressed. Just because you have a large deformity doesn't mean it's going to get worse, and so that will determine our planning there. The pattern of the deformity. Are we talking about a well-balanced curve, which we could probably watch? That means you have a curve that's at the top of your spine that's mimicked by one at the bottom, and sometimes we can watch those for longer. However, there are other types of curves, these more sweeping curves that we've that tend to get worse and be more aggressive, and doing something earlier tends to be a better option. And then factoring in medical history. Sometimes surgery is not an option because you have other medical concerns. So some of the take-home points, again, scoliosis being a 3D deformity, understanding some of the goals of surgical correction. Surgical planning is individualized. Your body needs time to adapt even after surgery. It's imperative that you have a good relationship with your surgical team, and you need to really discuss these topics with them, which include their considerations, some of their plans that might change even during surgery, what your expectations should be, and that would include a residual deformity, and giving your body time to adapt to its new shape. And this is a conversation you should always have with your surgeon. And I've just added a case here that the patient I had, where we had a thoracic curve and a compensatory lumbar curve, and explaining to this patient and family that we're only going to treat one of these curves and we're going to wait till for the other one to get better. And after surgery, they were unhappy because one shoulder was higher than the other, and we just had to wait and watch it. And then after 6 months to a year, everything sort of straightened up, and they were much happier. And it just takes that relationship. And they've returned to everything. And so again, this is one of those situations where you say, it shouldn't limit you from returning to all your activities and remaining healthy and active. Thank you.